Hi guys, it's Dr. Alyssa here to give you a quick presentation about dry needling. So as most of you know, I just got certified in dry needling. So I just wanted to give you guys a little more insight into it because I get lots of questions every day about it. So let's begin. So the definition of dry needling is a treatment that's used to help musculoskeletal pain and movement issues. The use of a small thin needle is released into your skin and penetrating that myofascial trigger point is the objective. And it's to get those trigger points to twitch and release so that the knotted area under muscle area will kind of dissipate. So common goals of dry needling are to reduce pain, both local pain where the actual trigger point is and referred pain. So say you have a trigger point in your neck, but your pain is in your shoulder. By treating the trigger point in your neck, your shoulder pain should also feel better. And then the reason it's called dry needling is that the needles don't have any medicine or anything in them. So that's why it's referred to as dry needling. So the formation of trigger points usually happen when our muscles are overused or overcompensated. The blood supply to this area quickly becomes inadequate, and the body senses like an energy crisis. So that means that the those blood vessels will constrict or shrink, and that doesn't allow normal blood flow to get to the area. Because of this, your muscles aren't getting proper oxygen and nutrients from the rest of your body, and your muscle is unable to return to its resting state. So that is not good, and that's usually what causes a lot of the stressed out feeling in your muscle, which then causes the area to become more acidic because it's not getting that oxygen and nutrients. And then because it's more acidic, the nerve gets more sensitized. And that's why the whole process just becomes painful and sore feeling. So how does dry needling work? So dry needling, really what it's mainly doing is increasing that blood flow to the area. So when you insert that needle, it flushes a rush of blood flow, and that's probably why your skin will get a little red during the treatment or right after the treatment. That's actually a good sign because your blood flow is increasing in those areas. Um, and in the dry needling that I'm certified in, it's called integrative dry needling. We actually are taught to look for trigger points near nerve fiber endings. And that prick will actually stimulate the nerve endings to fire off to tell the brain to release your endorphins, which are your body's natural painkiller. And then the when the needle hits the muscle or the trigger point, we want to get a local twitch response, which makes it feel like a quick spasm. And that's a good reaction because your muscle is becoming reactive versus like dead essentially because it's not getting any blood flow to the area. So some common things I see dry needling patients for are joint or overuse injuries, like any kind of tendonitis, big muscle knots, migraine and tension headaches are a big one. Whiplash injuries are common. Um, TMJ issues, really any joint issue that's causing your muscles to get tight and overcompensating is a good reason to use dry needling. There are contraindications to dry needling. You should not be dry needled if you cannot understand the treatment and therefore you can't consent to it. If you have a phobia of needles, this is probably not your kind of treatment, which is totally okay. If you're on any blood thinners or implanted medical devices, you should not be dry needled. If you cannot feel the affected area, so if you have like long lasting numbness to that area, that's a contraindication. A lot of people have increased risk of fainting, which is called vasovagal syncope is the fancy word for it. So if you know you have vasovagal syncope, you should not do dry needling because you are at an increased rate of fainting during the treatment. Unfortunately, any patients with any bloodborne pathogens, regardless if it's active or latent or acute or chronic, should not be dry needled as a safety issue. And then any patients that have allergies to the metals in the needles, mine are usually nickel or chromium, should not be dry needled. If it's a um, a large allergic response, that isn't a great thing to do. If you have like a tiny bit of allergic reaction to it, that's usually fine. And then the last big one is cancerous tissue areas should not be dry needle because the increase of blood flow can cause the cancer to spread. So you can perform dry needling on other areas of the body, but not where specifically the site of cancer tissue is found. So there are a lot of safety and hygiene concerns that I take into account every time I dry needle. This list is from the CDC itself. So wash my hands or sanitize before and after every dry needling session. I prepare clean fields. So I look to see if the skin is clean that I'm about to needle, and I try to keep my office nice and cleanly for you guys. You're only allowed to use single-use needles for dry needling. So as soon as I'm done with that needle, it's going straight into the bin, into the sharps container, and it's not used again. Um, the only exception to that rule is on the same person in the same region. I could insert the needle in a couple different spots, but I usually only do that 1 or 2 times, if that. And then if a blood drop appears, this is usually more common when I'm taking the needle out. I have to sterilize that area with an alcohol swab, and then the swab just needs to be disposed of according to Colorado state laws, which actually just says I can just throw it in the trash can. I usually try to wrap it in something else and then throw it in the trash can. And then, like I said, the used needles are always inserted straight into my sharps container, and the lids are closed and safe. And then when the container is filled, I take them to a sharps disposable site. So the patient assessment, this is really important. First, I always start with an in-depth medical history. That way I can make sure that there aren't any contraindications to care with dry needling. It's funny how a lot of times things will pop up when you're just chatting with somebody and you're like, oh, maybe you're not actually a good fit for this. So that's really important to go over. Next step is the consent to treat form is discussed. I have a pre-made form already that you guys can read through. If you have any questions, comments, or concerns, we chat about them. There are a couple yes or no questions about blood thinners, medical devices, that kind of stuff. And the patient must sign and date before continuing on. And then I perform a physical exam, usually with palpation to determine those areas of trigger points. And we begin the process from there. So what does a dry needling session look like? Well, first, I will locate the trigger points that we're going to be treating that day. Clothes may need to be adjusted in order to reach that treatment area properly. Sometimes clothing does need to be removed. We are in a private room, but I will always offer you a gown or a sheet to cover you if you're not comfortable with that. After the trigger points are located, I insert the needle. So I'll place one hand on the trigger point and let the other hand guide the needle in with the use of the guide tube. That's usually what patients feel, is that guide tube landing on their skin, and then a quick prick when I insert the needle, which is that tap part. Excuse me, sorry. So I tap the needle in just into the very first level of skin while I remove the guide tube, and then I put in the needle into depth. So there are 2 ways to do this. There is the superficial needle way, where I'm only getting into the subcutaneous layer, which is right above where the trigger point lies, or deep, which is the needle is inserted all the way into the muscle tissue layer, and I'm actually penetrating that trigger point. Techniques, there's low dosage and high dosage techniques. Um, Using less than 10 needles in general is considered low dosage, and I perform no needle manipulation. So that means I'm not moving the needle at all. Once I insert it, it's just staying in for up to 20 minutes, usually right around 10 or 15 is low dosage. And then high dosage is using a lot of needles. So more than 10 is the technical term or the technical definition. And then in high dosage situations, I might manipulate the needle. I might use the pistoning technique, which is in and out, in and out, in and out. Or twisting is another needle manipulation, or tenting, which you twist and pull up at the same time. And electrical stimulation can be used in a high dosage situation. If any of you have been dry needled by me before, you know that I stick to more low dosage, especially on your first couple visits. because I really want to prevent any prolonged lasting soreness afterwards. And then if you have any questions for me, please reach out to the office. I'll be happy to answer any. I hope this was helpful and you understand a little bit more about dry needling. Thanks, guys. I hope you have a great day.